We're implementing a project entitled ICT for Health Service Delivery, funded by Sida through CIPESA, and we are being funded in a network, ICT for Democracy in East Africa.
We are working in 26 health centers, and it is basically ICT that we use to monitor health service delivery in these health centers.
In this network, there are 7 partners, and Transparency International Uganda is one of the partners. The 2 top-line objectives include improved citizen participation in governance and realization of human rights through ICT, and then also improved transparency and accountability of governments through ICT.
We used to look at Transparency International as a foreign base that was coming to blackmail government and undermine the sovereignty of our state because of the TI indices that used to come, the bribery index, whatever. That was pointing out clearly well our shortfalls in terms of addressing the problem of corruption. So when we came together, we understood the work of TI, and we realized that actually it is a very useful tool to help us improve on how to fight corruption.
In the studio, we have a team from Transparency International Uganda.
We use the radios mainly to create awareness, and then we use the social media. We have a Facebook page which we are operating. We also have Twitter, and then we also do blogs.
When we carry out these activities, we normally put on Facebook where people we share, where people are able to make their comments, and some of these comments have helped us as Transparency International, the field workers. It helps us also as we implement, we always, because people give in ideas, we come and share with the district, and at times we are like, can this work out? Can we do this so that we improve?
Facebook
gives us opportunity to interact with other people. We are able to see whatever is happening also in various places, and we are also able to post also the issues that we have.
Those who are not able to reach us through the internet, we have another option where someone can call. And this calling does not mean someone should have a smartphone. Any phone someone has, you can easily reach us because the number is free.
There are issues that we, as a district health office, cannot directly get unless the community members report them.
When those calls come through and I receive a call or a complaint, we have a template where we record the complaints of the callers and then generate a report. When the report is generated, it's forwarded to the project or what we call the program officers who follow up these phone calls.
When we receive any information through these platforms, we share with the responsible duty bearers.
Transparency International Uganda always come to point out key areas that need attention. And once we pay attention to that, we see improvement.
In this project, we have engaged more with the Ministry of Health to ensure that the issues raised through the ICT platforms are discussed, mainly the ones that need policy attention.
We have had in recent past a few sporadic cases of measles, and we have used this opportunity given by Transparency International to pass messages to people, particularly in Kamdini, in that area of Minakulu, where during rainy season people go to the other districts to do farming, and so the children do not complete immunizations. So through this use of ICT, we communicate with the communities. We tell them the importance of government programs such as immunization, maternal and child health, hygiene and sanitation, and many others.
When we receive, we compile and share. So after we have shared with them, we call them Also, a platform, there is what we call advocacy meeting or stakeholders dialogue, where we sit with them and we interact together.
They also supported us a lot to understand the perception of the community about health service delivery. And we are able to move with them to conduct community dialogue meetings, where we were able to get the full package from the community about our health service delivery, where they were able to drive us in a proper planning.
When we have meetings with the VACs and Transparency International and other stakeholders, we come up with action plans. We then follow those action points up to their logical conclusion.
We are now starting to do the work, serious mobilization, as well as using the villages team to help us mobilize the community. And the villages team, above all, the one they have trained as a community monitor, and they're doing the work.
We were trained to go and monitor health centers, how there is service delivery. After getting the training, we also go and have community training to help them out to use the toll-free line.
We knew nothing. People had been consuming our money as community. We have no any other objectives of monitoring or checking or intervening in the corruption which was going on in our community.
The community have a number of problems, of which most often they don't have elsewhere to report immediately so that they get instant help. Now the VAC installed in place, initiated by TIU, has come in to get various reports or issues affecting the community and try to resolve them with the community together at the community level, and later on at the parish and sub-county level, and then the district.
Because I represent mostly people with disability in the facility, according to service delivery. You can see ramps in every buildings. At time we're monitoring late coming, and now it is more improved.
The district had some critical cadres that were missing. One of them is a senior medical officer we are not having in one of the health sub-districts. And we are not having some cadres like midwives. And from that assessment, we were able to recruit the senior medical officer of one of our health sub-districts called Amach. And we were able to recruit midwives and other enrolled nurses. And right now, as we talk, at least we are now at 91, the staffing level.
We are glad that whenever we call transparency, they follow up immediately. Transparency International created awareness to the communities. There is great improvement at the health center. So this has encouraged everyone. Now whenever they are sick, they come to the health center. Out of this, we have a number of impacts that have been created. Among them is we have addressed issues of shoddy work at health centers, late arrival and absenteeism by health workers in most of the health centers.
The facilities that were at the level of health center 2s now have been upgraded to health center 3. We have seen improvement in budget for drugs. Although we are saying it's not yet enough, but at least something has been done.
Most times the communities call and say, we've been seated here for a long time, we've not been attended to. And what we do then, we follow up, we go and look at attendance list, and then we follow up with the health units to ensure that we correct the issues of attendance to duty.
We've been able to put a few measures in place to address attitude change and to address customer care. We've now had meetings in sectors. Apart from general staff meeting, now we run nurses meeting. Nurses and midwives have their own meeting. which we discuss issues that nurses are supposed to do and midwives. Then we have laboratory. We now have departmental meetings for laboratory, for nurses, for art clinic. Those are aimed at attitude change, teamwork, and customer care.
We really appreciate the efforts of this project, and we think that even with the resources that we have, because we know the RDC's office still has free airtime, this is an opportunity for us to continue using ICT to pass messages to the communities.
It has been a positive partnership. It has brought results. Whenever there's a problem and we're called by Transparency that we've got a phone call from your facility about issues of maybe harassment, issues of what, we act.
I'm happy to say that I've participated in most of the advocacy meetings that was organized by Transparency International, both at the national level, the district level, and also at the sub-county level. At the national level, I was in a position to interact with the people at the ministry here. We are able to, you speak out, because they are in the meeting. Nobody will say that you're bad or you're good. You speak it out, and then they will take it straight.
The biggest challenge right now is there are areas that need policy revisions, and this may not be addressed from the lower local government here. It might require national level engagements, and this is where we are trying to put our heads together to see how we can craft things and flag some of these issues at the national level.
And that's actually, we have been working and having discussions with civil society organizations and the district officials that, for example, the DIPF, District Integrity Promotion Forum, should find another platform within their jurisdiction, like the sub-county platform and maybe the parish platform, to complete the process of government. But we cannot do that because it is a jurisdiction of local government.
We have provided a platform on which people can report. We have provided a channel, a reporting channel. We have provided a tool that can be used for disseminating information, for generating issues to be advocated for. So in short, it has been, I would say it has been very successful because we have seen the results. The results are on the ground. There you can touch them, you can see them. People can testify that after calling our toll-free line, they received this and that assistance. And it can also be tracked. We have got it documented.
The civil society organizations are already organized and informed bodies that we can work with them to get their views to be included so that we develop very good laws. So in that vein, we have been working jointly to develop very good laws. I will cite the laws that we have come out together with, the laws like the Anti-Corruption Act, the laws like the Whistleblowers Protection Act, laws like Access to Information Act, and many others.